in the female body and female life as such, especially regarding the hormones and uh, because of the stress that they have in their lifestyle, diet, lack of exercise, and lack of sleep. There are many other factors which the woman of modern age is undergoing that has been affecting her health. In particular, you take the adolescent age, wherein Dr. Kalpana would agree with me that there is a lot of incidence of PCOS, polycystic ovarian disease, wherein which is mainly determined by their lifestyle, that is diet, improper diet, and lack of exercise, and lack of proper nutrition in that age group will result in hormonal imbalance. And many of these young girls come with lot of body changes that is happening because of these hormonal imbalances. So that is one thing. And coming to the reproductive age group, we have menstrual irregularities because of the hormonal disturbances, and difficulty conceiving has become a very common problem in reproductive age group. So that is because of hormonal imbalance, as well as then delay in their marriage because of the career. They want to pursue their career in their life, so that is causing a poor ovarian reserve. Being an infertility specialist, I know very young girls coming around 25 to 30 years with coming with low AMH, low ovarian reserve, wherein their eggs are already low when they start their reproductive journey. So because of the diet and many pesticides that are being used in the fruits, vegetables that the we grow in the field, so that is also causing lot of problem. And many, we unlike earlier years, we are seeing many young girls with low ovarian reserve and coming for infertility treatment. And many of these uh, uh, working in IT companies, they have disturbed sleep because their scheduling online, working online gives them lack of sleep, because they do work in the night, and work pattern are little different, and that is adding to the stress of their life. So these are the things. And coming to the holistic approach, being an allopathic doctor also, I have always been believing in considering a woman or of any person for that matter in a holistic way, because health is defined in a holistic way. It is not just physical, it is not just the disease that we treat, it is the mind and the body and the soul along with the person which comes, and we have to take it in that sense. And allopathy usually provides the cure for the disease in an emergency situation, whereas the prevention and holistic health is of course team approach, and it has to include inclusive of other medicines also. So it has to be a holistic approach to what you mean when the woman brings out her best of her health into her life.
So it's a very well-known said thing that as women sometimes we say, "Please touch me not. I'm hormonal," right? And those
Yes.
days are sometimes too stressful for us. So when you say hormonal, can you tell us, elaborate on this fact? Which are these hormones which
Yes.
affect our health, and what is the role each hormone plays in our mental well-being and our physical well-being?
Yes, it's a very relevant question for the audience, I believe. We have male hormones and female hormones, as we know, when the boys and girls become men and women. So these the changes are responsible because of the actions of these hormones. We have mainly two hormones responsible for the changes in the female body when the girl becomes a woman. That is before the puberty, the secondary sexual characters start appearing, like enlargement of the breast, pubic hair, axillary arm hair. These changes start becoming visible even before the girl has her first menses. We have estrogen, which is responsible for these changes. These estrogen hormone is secreted by the ovaries. These are the two organs alongside of the uterus, and we call it as a reproductive tract of the girl. So these ovaries start producing eggs. So when the egg is released, then there is ovulation, and they become capable of carrying a baby or getting pregnant. So these estrogen hormone is responsible for the physical changes that happened around the period of menarche. And progesterone is another hormone. Progesterone is secreted by the corpus luteum, that is the cells remain after ovulation, whatever is that, usually progesterone appears in the second half of the menstrual cycle, and these two hormones together are responsible for controlling the menstrual regulation, that is the cyclical changes that happen in the reproductive tract. They support the endometrium lining, and once the progesterone action is over at the end of 14th day, when there is no pregnancy, the endometrial lining, the lining of the womb, sheds in the form of menstrual blood flow. And we have another two three hormones secreted by the pituitary. The pituitary is a small endocrine gland which is lies along with the brain in the skull, as the cranium. Anterior pituitary, it secretes two hormones which regulate the function of the ovary. That is, one is follicular stimulating hormone, that is we call it as FSH, and another is LH, luteinizing hormone. So these two hormones regulate the secretion of estrogen and progesterone from the ovary. So these again give the feedback message to the pituitary to secrete FSH and LH according to the need. So these are orchestration. It's a beautiful orchestration among the hormones so that they control the cyclical nature of our menstrual cycle, secondary sexual characters in the female body, and of course the ovulation, and that is leading to pregnancy. We have another hormone, human chorionic gonadotropin, which appears during pregnancy. That is the hormone of pregnancy. So these are the hormones which are typically responsible for the functioning of female reproductive tract.
Thank you, Dr. Geeta. That is a very great piece of information. And I think, as my dear friends, I feel as women and as men, we have our bodies. We have our physical bodies, we have our mental bodies, and we have our spiritual beings inside. Now, the body is considered to be a vehicle, and one has to take care of the vehicle. If you have a car, if you have a scooter, I think each of us takes good care, goes and fills petrol, nahi to nahi chalega gaadi. It doesn't work, right? And what do we do to our own bodies? Do we really understand that this is what is happening? Did any one of y'all know that there are these names of hormones? The typical point I feel when a woman approaches a gynecologist is either when there is a problem, and then she says, "Oh my dear, she's asked me for so many tests." But I think Dr. Geeta has made it very simple for us to understand that our entire cycles, which we go through right from the time we have been born to get us into, so the time we are born is the first initiation for us as a woman. The time we enter our puberty is a second initiation. The time we consummate our marriage is the third initiation. The time we birth is the next initiation, the fourth initiation, and then is the menopause, and then is finally your death. So, as women, we go through these five phases, and do we really cherish and accept those phases and work on those phases? This is something which each of you should really look at when you all are, each of us should look at when we are walking the way. So my next question to you is, Dr. Kalpana. uh, she has mentioned about the hormones. Dr. Geeta has mentioned about the hormones. In your experience as a gynecologist, what are the key lifestyle changes and health considerations individuals should focus not only when they are planning pregnancy, but also when they are leading? The first phase is when I'm working, but I'm not looking at my menstrual hygiene or health, or even as a youth, much younger than that. How do we care? It is not about us depending on our moms. How do I care for myself? This is something I want you to elaborate on. Number one, in the youth phase. Number two, going ahead when there's a balance of work and my own physical self, and third, when I'm planning to definitely go in for my pregnancy.
Yeah, thank you, Dr. Snehal, and good evening to all of you who are on the webinar. It is a very interesting question, Dr. Snehal, because one, awareness. Awareness has to come in to the youth. Unless they start becoming aware at that young age, they will not know their own body.
Yes.
Firstly, yes. Firstly, I really want to share something before I start talking about these things. The reason why I got into birth center was I wanted women to understand their own body and take the call. unless they don't understand their body and take the call, they will not be able to do anything further. Youth are so caught up with their education. There's so much of social pressure on them from the parents or the society and things like that. And they're so focused on their education, then what further? So it's only the material part they are totally focused on, and the financial part also comes along with that because they want to be independent. So their thought process goes in that direction. But in that race, they forget about their physical part, and they forget what they have to eat, the dietary part, and also their mental issues, because at a very young age they start stressing out and anxiety sets in. So the proper guidance to them during this youth, or this age between 15 to 19, is very, very important with all aspects. Even before that it would be easy. I mean, they would understand nowadays because of the social media and things like that, the exposure basically what they have at the age of 13. So what would be more important is concentrating on not just like the holistic approach, not just concentrating on their material part. Yes, of course, material part is also important for survival. Then what is to be eaten, they need to understand what is a healthy diet more than a diet, because when you say diet, people think that they have to not eat. It doesn't go in that sense. You need to eat a healthy diet or a healthy meal, and then you have to sleep well. So your work also becomes important. If you're on a night shift on a US call, you're off. So that's when all these things set in, like the AMH goes down because you're not sleeping well and your stress levels are high. So that also relates to the AMH, which goes down, and the eggs are very poor when you talk about only these things. And then your mental health, again, like I told you, the stress comes in. So how do I go about all this? I need to learn something which will help me to balance out all this. Luckily I found heartfulness, so I'm in a good space. I hope the youth also finds heartfulness very early in their life, so so that they'll understand what it is. And I spoke about the work and self. So pregnancy, I would go to the pregnancy part. The pregnancy, again, we need to start preparing at least 3 to 6 months before the woman wants to get pregnant. And of course, if you have an issue, then that needs to be addressed in infertility. But otherwise, if she is a normal woman, fertile, trying to get pregnant, then she needs to understand that she needs to just have a basic workup, like probably her thyroids, hemoglobin, and more probably even her blood sugars would help. A complete blood investigation would help her. And again, mentally preparing for this, both the partners, not just she, both the partners, the couple needs to prepare for this, because it's not just she who's giving the birth, it's both of them together bringing somebody into this world. So we need to understand that love is the base. Nowadays what we are seeing is they do it for the sake of pressure. They try to bring in something where they don't have the time, and they also try to push having a baby because desires, needs and desires come in. So these are the few important things we need to understand. And timing of the pregnancy is very important. The younger the age, it's better, so that we have the life for the child who we bring in, and also we have the time, and even our parents can take care of the child. I think that rounds up most of the things which I had to
Yeah, I
tell.
remember beloved Daji some days back, some years back, couple of years back, he was telling a group of youngsters that imagine if you get married late, what happens? It is your
Mm.
phase of menopause and the
Yeah,
phase of adolescence, both in the
very true.
house. So, if the
Yes,
adolescent is at home with her hormones or his hormones,
it
and
becomes
you're
very difficult to live.
it's very difficult to live. So
Live,
the
yes.
earlier you get married and the earlier you have your children, the
Children
better it is to take care of your own body, to look better, to look young. As you, who wouldn't like to be a
look
young
young at
grandmother? Why not?
grandmother. Yeah,
So
yeah.
Many a
yeah,
times it
Mm.
happens where for patients coming for IVF, already they have
Mm.
crossed their age 40. So when
Yes,
they
yes,
deliver, their mother has to take care. Recently, today I have admitted a
absolutely.
patient who is conceived with IVF. She is 43 and her mother is
Okay.
70s. Her father is in her 80s. So both mother and father are taking her care. So it's very practically very difficult and challenging for the whole family to have a pregnancy at a later age.
yeah. Somewhere I feel when we go a little away from nature, all these
Yes,
problems set in.
very right.
So there's a beautiful quotation I would like to read out of by Albert Einstein. It is that the world we have created is a product of our thinking, and
Thinking.
it cannot be changed without changing our thinking. So,
Absolutely.
as a developmental therapist, which I work as a professional, and as also a neonatal therapist, I see a lot of high risk babies who come to me. And when they come to me, they're as innocent. I mean, babies are
Yeah.
innocent and they're
Innocent
wonderful.
anyway.
And many times it is the pregnancy which is gone at a high risk, or the mother who has been stressed out, or preeclampsia as you call it, has set in the third trimester of pregnancy, which endangers or puts the child at a high risk, in the high risk category. So again, the next question to you, Dr. Mansha, is what is a high risk pregnancy, and which are some of the some factors which we can change naturally. It is everything is becoming artificial, and the moment a woman conceives, especially in India, she is being declared high risk. So pregnancy is not a disease, my dear friends. It is a beautiful phase which you should walk through. So Dr. Manja, what are the high risk pregnancies, and uh, the myth that every pregnancy is high risk is to be removed by you. So over to you.
Very good evening to all of you. Thanks to giving me this opportunity to be with you all here. First of all, as you said, ma'am, that pregnancy is not a high risk or not a disease. It's myth. It should be removed from everyone's mind as well as from heart. Because once of a woman gets pregnant, she thinks, "Oh, I am diseased person in this family," and she feels very low every time. अगर थोड़ा-सा भी उसको पेन होगा, मैं तो बीमार हूँ, मैं तो बीमार हूँ, मैं अपने को कैसे देखूँ, मैं फैमिली को कैसे देखूँ? मतलब वन्स
Yes.
और मतलब एवरी डे ऑफ हर 9 months how she uh, goes to day by day, she feels like I am ignored one in this family. So we have to remove this thought process of every woman that this is a natural phenomena after marriage, and she has to enjoy this thing with a loveful way, and should welcome new coming baby. It's he or she, and this is not a high risk every pregnancy, we can say. Like if it is under control, like if she is getting pregnancy under the supervision in the gynecologist trained person, then it's good. But if it is unsafe pregnancy or unplanned pregnancy, then it is going to definitely to land up in a high risk one. High risk means like if she is having any medical problem before getting conceived, like she is having any blood pressure problem, any diabetes issue, any thyroid problem, as Kalpana ma'am has already mentioned earlier in this, that one women should get check her blood test routine, hemoglobin or thyroid, like these things. If she is anemic, then it is also going to harm her as well as her pregnancy. So there are some routine antenatal checkups we are giving that as a protocol, like hemoglobin, blood group, blood sugar, thyroid level, and some hemoglobin related diseases like thalassemia, sickle cell disease. And for if she is having blood pressure, then she should have normal urine checkup and blood proteins, blood uh, cholesterol levels checked every given time periods, like 4 weeks or 6 weeks. And if she is having any previous issue of like previous preterm birth, then she has to get checked every 4 weekly or 2 weekly. And if she has any multiple pregnancy like twins earlier, then also she has to get checked her uh, proper checkups early. And we have to see like if it is IVF pregnancy, as Geeta ma'am or Kalpana ma'am has mentioned about this thing, and they are getting it in older age, like after 40, this is a very critical condition. Then they have to proper check protocols. Like they are very prone to get diabetes, they are very prone to get pregnancy-induced hypertension, and they are very prone to get multiple pregnancies. Since if I am not wrong, Geeta ma'am, they are very prone to get multiple pregnancies and
Mhm.
Yes.
deliveries. So we have to be very careful, and if these patients need proper counseling from diabetic specialist, from mean to say pediatrician as well, from genetic counseling also they need, because जो IVF के pregnancies होते हैं mostly उसमें genetic problems होते ही हैं, तो they should be have a proper genetic counseling also, pre-genetic implantation testing, pre-genetic diagnostic testing, they should be done. And they should be informed that at 13 weeks normally we do what to say NT scan, it should be done. If it is normal, then well and good. If it is not, then they should be get to done quadruple test at 18, 16 weeks, and anomaly test. These are normal tests which are being offered to those women. So this is key. Time to time they should be get checked, but they should not feel that it is a disease. They should follow it as a normal phenomena. That's what I want to say.
Thank you. So, all of us on this show definitely believe that pregnancy is a beautiful phase in life. It is a natural phase in a woman's life and a man's life. Both of them walk into it together. The time it becomes complicated is when our intention and our thoughts get clouded with stress, thinking, anxiety clouds us, sometimes rejection. So you conceive naturally and then you say, oh my dear, I've conceived. I don't know how I've conceived. So my next question to you is to Dr. Kalpana about this shocking news which comes and people don't want it. So United Nations states that all unintended pregnancies that happen each year globally, more than 1 in 7 of these cases occurs in India.
Yeah.
What are the means by which we can control this? Recently, I had a case, and uh, see, for us, rejection as human beings is not taken. So babies also don't take rejection. And one of
Yeah.
the doctors, whom one of my patients, sorry, who came to me with a child who is now a special child, is a case of autism. I asked them always, what was your route through pregnancy? What happened? So she said, you know something, when this came to me, I was shocked. I really didn't want to walk the way. And that is sometimes, my dear friends, one could be one of the causes that babies feel, oh dear, I'm not
Yeah.
wanted. And babies are sentient human beings. So this is a very, very pertinent question. Unintended pregnancies, what can you say about it, Dr. Kalpana?
Yeah. It's very saddening to talk about this. But anyway, the thing is, in the world, I'll just go back to the population. In the world, about three-fourths of the population is youth, and out of which the young women, they actually there are about 167 million young
Wow.
women in our India. And most of the times in a developing country, we see that in a low socioeconomic and the middle socioeconomic status and the geographic distribution, we see that this unintended pregnancies are more. This is mainly because there's a lack of awareness, the family size is big, responsibility starts very early for them, and also their inhibition they start living together with the person whom they want, and they do not know how to use contraception. So the awareness of contraception or family planning is not there for them, and they don't reach out to the healthcare. These are the things which happen. And in the urban area, it's more so because what I have been seeing in practice is you have girls coming in from the two-tier or three-tier towns. They are not exposed to anything. Suddenly, the internet is there and the social media is there, and they're given that freedom. So they get into this act of being sexually active, and they come in with unwanted pregnancies or unintended pregnancies. And even they sometimes are not aware of these family planning methods, what are available for them. So the government has come along with a lot of programs where the A&Ms and the Anganwadis they can be reached out by these girls, and they can actually go and talk about it to them, because in India they do not talk to parents about all this. This is one stigma which they have, and once they know that they're pregnant, it worries them a lot, because they're going to be an unwed mother or otherwise, and it becomes a lot of pressure for the family. And so this lands up with abortions. Most of the time, 99% of the women undergo abortions. So this has been a very big concern, but the abortion has dropped down from 51% to 48%. So that's a good thing where the awareness has come in. So in the long run, we need to learn to actually, even in a small practice, we should learn to have a counseling center, or even a place where they could come and approach a helpline, things like that in an urban area, which is not there really. But in the rural areas, they are always been able to go and approach the healthcare helpers who are available, and make them aware of all this, so that they'll not go into having an unwanted pregnancy or unintended pregnancy. But we have seen that the women are not much aware, but whereas the men are more aware of all this. But in spite of it, it happens.
Yes.
So this is something we need to understand and work on it even more, because we are a developing country with such a huge population, and we have the girls, especially in the age of 15 to 19. Basically, they are the ones who are the targets, and the younger girls. So this is the main group which has been are the people, girls or the women who have these unwanted or unintended pregnancies. So we need to catch them a little young, give them the education of, it's not just the reproductive thing which is given in the school. They need to understand this the sexual part also, because having sex at what age and the multiple partners or all those things needs to be told to the youngsters, so that they don't get into all this unwanted things, and they actually become a better human being with all these, not values but understanding, and try to take their lives in a better way, is what I think about this.
So thank you, Dr. Kalpana. That was indeed a very deep answer, and it was a very profound answer. Sometimes we forget to listen that we are the creators of the new world, and how we take care of ourselves for the
Yes.
new humanity to come in will determine the new world. So you mentioned something about midwives, Dr. Kalpana, and Dr.
Yes.
Geeta has been doing a lot of work on midwives. Could you elaborate on the role a midwife plays? Because no one knows about
No,
midwives.
what else?
But out in the West, you have doulas, you have midwives working very consistently with the woman. My daughter recently delivered a baby. She is now, my granddaughter is around 4 months old. And during the entire pregnancy, there's a doula who helped her through. There's a midwife who comes with you in the delivery room, and you're taken care of by them so well. Why is
Yes.
this missing in India? And are you doing something about it, Dr. Geeta?
That's a very welcoming
Very,
question for me
yeah,
because we just want to
very
speak
true.
about it now. But me
Yes.
and Dr.
We don't
Kalpana
want to
can,
preach. Yeah, we don't
yes,
want to preach, but we want to talk.
practiced. Because as you earlier said, pregnancy is a natural thing that we have forgotten. The pregnancy and childbirth has been medicalized so much that the moment the woman is pregnant, the family thinks of going to hospital. It's not required. As our olden days, our grandmas knew what to do with the pregnant women. She knew what to give, what not to give, how to take care of a pregnant woman, even how to birth the child in at home. Now, we had so many home deliveries, and women used to deliver themselves and start working immediately after that. We have heard such stories earlier. So the childbirth knowledge was inherited in the family, but
Yes.
now it is so much medicalized that even as medical students, as once we start thinking about pregnancy, and when a pregnant woman comes for antenatal checkup, we always keep talking about the test she has to undergo, medications she has to take, rather than stressing on the naturality of pregnancy. So where is that, there comes the role of midwife. Even as I wonder, after getting my MRCOG, FRCOG, going to a London highest degree in my profession, I was never told the details of, I was never taught rather about the details of natural birth. So we always perceive it as a medical condition. We are always on our toes to intervene with the natural process of childbirth. So that is what a medical system has been, and most of the obstetrician and gynecologists are trained like that in Indian scenario. So in that case, when a woman goes, and midwifery practice had been earlier in villages and all that, but it has not been a mainstream of childbirth or pregnancy care health system in India. But where midwife perceives it as a natural. Now I have a pile of books, about 50, 60 midwifery books I have bought online. So after that, now I have started reading midwifery. So they are such beautiful, and the women are made to realize the capacity of their own body to give a childbirth naturally, how they function, how to connect with the body. And that is a wonderful experience which we are all depriving all these mothers of,
Yes.
getting them into the medical system. So there comes the role of midwife, because I, being an obstetrician, cannot keep talking about childbirth, what she should do, how to support her during labor, and it is difficult. So in that case, midwives are the connecting dot between the women and the obstetrical care system, because obstetricians are needed, because when there is complication, we have to attend, we have to have that system standby whenever a mother, because to reduce the maternal mortality and the perinatal mortality in India, obstetric system and support has to be there. But 80 to 90% of them will deliver normally. They are not to be brought into the hospital directly, and there comes the role of midwives and doulas. So they usually perceive it as a natural phenomena, support the pregnant woman in every stage of her pregnancy. They know what to do when, and how to support her during labor, giving her comfort during labor, and helping her everything that she needs physically and emotionally, which a doctor cannot do. So even we had discussed it with Dr. Kalpana when I met the other day with her in Bangalore, how to make this midwifery a part of the antenatal care in India. So it is the key factor is availability of midwives. As doctors, if we have 2 3 midwives working with us in my hospital, why will I do cesarean? So if they will take care
Yeah.
of the so it's mainly the lack of midwifery training that is happening in India. So we need to have lot many midwives. Then all obstetricians will have to work with midwives. So it is an integrated team approach. So whenever there is a high risk pregnancy, there is medical complication. Of course, obstetricians have to get in, but otherwise, majority of our pregnant women need midwifery care, and that is the need of the hour, I feel.
Thank you. So, Dr. Kalpana, when a woman labors and gives birth without disturbance, the natural birth as it is known, her body produces peak levels of birthing hormones. And one of the main hormone is the love hormone, oxytocin.
Oxytocin.
And the reason why people, I mean, women cannot birth naturally is because they miss this oxytocin. And your institute, which is called as Madilu, Mother's Lab,
Yeah,
is
yeah.
is serving people and spreading love. Like how? I mean, can you elaborate on this process and how the woman's lifestyle, her stress, can affect the love hormone? How can she? Oxytocin is needed, woman. It is needed for
Otherwise,
everything.
yeah,
So
yeah,
how you that, and that is the reason Mother's Lab, right? So can you elaborate a little bit on this, Dr. Kalpana?
yeah. Uh, your question was oxytocin. Is it needed? Yes, definitely, it's
No,
needed.
it is needed,
It
but
is
how can
needed. Yeah.
a woman gets stressed. The moment she gets stressed, I'm sure the dilatation is closed. It does not occur more. But the more you give oxytocin, the more you produce. How can a woman be encouraged to produce oxytocin? What
during
is it
preg-
that,
during the
yeah,
labor. Okay, during the
key
labor.
role, what a woman should do? She should be made to understand this, that oxytocin is a
This is
key hormone.
exactly what the midwives do. You know, the way they pamper the body of the mother during labor. You should just see it, to believe it. And the way they help them to be whatever they want to be in the room. And they help the partner to be with them and cuddle them and actually listen to them more than advising anything, and letting them do what they want, not giving instructions. That's the very important part in a labor, not giving instructions. That's the main difference in a birth center and a hospital. So, we are trying to be more passionate towards them, more loving towards them, and that's when the oxytocin really comes more. And it's wonderful to see it. You should see some videos on the YouTube to understand, and the water which where they go into, even that helps them to really relax. Once you're relaxed, the stress goes off. The stress hormone is nothing but the cortisol hormone. The cortisol hormone generally does does reduce the contractions, and it stops or it reduces the progress of the labor. So all these things, these smaller things, will be taken care. We think it is very small, but at the end of the day, you realize that these are the important things which are missing in obstetric practice. And
So,
it's
there's
sorry.
another question I would love to ask you, Dr. Kalpana. You have been a practicing heartfulness trainer and a practitioner both. Oxytocin is known as a cardiovascular hormone. It is the first hormone which has, it's believed to be released from the hypothalamic nerve, and suppose the heart is also supposed to release oxytocin. So the practices of heartfulness, do you feel that they will help? And is there any study done, or do you propose a study to be done in the role of heartfulness practices
And
in?
doctors during labor. Yes, I would definitely love to do this, because there's no study at all.
Yes.
There's no study at all. So I would
We say
love
that
to
heart is the organ of love, and
love.
heart,
Yes,
it is
yes.
oxytocin is known to have a cardiovascular origin also.
Origin,
There are
yes.
studies and there are papers. I think it would be worthwhile to bring the two
Bring
together
about,
and
yes.
see
I've
how
not
we.
read any papers. I have not read. Probably you could
So
enlighten on
yeah,
that.
during my, I've been recently doing a pre and perinatal psychology course, and a lot of reading has happened where the heart, being an organ where oxytocin is produced or released, and it's something which I was thinking, and I felt this is something we should adopt, the three of us, and even
Yeah,
Dr. Mansha. How can we adopt these techniques and see if we can change the canvas of health in the women of India today, and that would be
yeah,
make a big difference to a lot of people in many cities who are looking forward for respite from to consider this feeling that comes that it is a disease. I think that is something where people are really wanting to look at even the health. I mean, if you look at a normal health, since you're going to Accenture, I'm sure Dr. Kalpana, you know what are the health conditions
Yeah,
which women do look at. Yeah. So,
very true.
Dr. Mansha, my next question to you is, um, the World
Yes.
Health Organization states that developing countries bear the burden of 97% of unsafe abortions, just talking about abortions. More than half of unsafe abortions occur in Asia, most of them in South and Central Asia. What are your thoughts, and how can we prevent unsafe abortions? And do we
Yes.
really need to instrumentalize the woman? I think instruments should be kept away from the health of the woman, is what I feel. I'm a firm believer of that.
Yes, ma'am. It's very true that in developing countries, mostly we are seeing that unsafe abortions are at the higher rates because lack of proper infrastructure, lack of sources, and lack of awareness. Lack of main thing is that there is lack of education among the women or the young girls because reproductive health and reproductive rights they belongs to not only women but the young girl from we can say from the childbirth to menopause. That is the reproductive health. As soon as women a baby is born, her reproductive health starts since then only. So proper education, proper communication, proper information about health system to that lady, to the mother, is going to help her as well as her child. It's when it is girl child. So how to protect her or how to protect herself to get safer pregnancy and to avoid unsafe abortion. And for this, Government of India in the association with Ministry of Health and Family Welfare, they have launched many programs for reproductive and maternal and child health with adolescent. And there is a program for Rashtriya Swasthya Karyakram for to say Yuva Work. Yes, and they are helping a lot, preventing, for counseling, for giving treatment for prevention of these unsafe abortions because they provide proper education for uh, unsafe pregnancies and unsafe abortions to help safe motherhood, safe child health, safe delivery. And it's their family planning programs are running by Government of India. They give proper communication to each and every uh, woman of a village and under their programs about all the available contraception, uh, whether they are in the form of like there are many contraception methods. They give all the details to the woman, like barrier methods, non-hormonal methods, hormonal methods, and like temporary methods and permanent methods. Hormonal methods, they are like medicines to take daily basis, or there are patches to apply it weekly, or to get intrauterine devices which they can change every 3 years or every 5 years or every 10 years, and there are hormonal implants as well. They can be changed every 3 years as well as 5 years. They all are reversible processes. Like when they want to become pregnant, they can remove it. They can stop using it, and they get pregnant within 2 3 months if they want to get pregnant. And there are permanent methods like they can if their male partner want to get, they can get done by vasectomy surgery method, and if female partner want to get, that is by tubal ligation method. And there is natural method like abstinence method, and there is one like we can say natural is giving proper education about their hormonal levels and when they are fertile, like when they what is a safe period and what is fertile period. If a woman is having normal menstrual cycle, then 2 days before ovulation and 2 days after the ovulation, it is a fertile period. So if women we make aware that woman that she should be conscious for that period, then she can prevent this thing like unplanned pregnancies, unintended pregnancies, and they can be avoid unsafe abortions also in this way, we can say.
If you permit, I just
Thank
want to
you.
add a point
Yes,
because now the MTP pills are available over the counter.
Over the
yes,
We have
count.
seen many patients taking medicines of abortion through a pharmacist and taking themselves and landing in trouble. It's very
Yeah.
important that all women know that abortion services are available with every medical practitioner. They go and approach them and have a proper advice, because without taking tablets without a proper scan, has I have seen many patients landing with ectopic pregnancy, taking those tablets over the counter and landing up with major surgeries and life-threatening complications. So it's very important that they know that services are available. They need to approach the practitioner, and safe abortion is their right once they get pregnant. So that awareness has to come among the women, and they have to seek the. And there are many quacks. You mean that is
Yeah.
unqualified people in villages giving medical MTP tablets to women. So these things have to be avoided, and they have to seek a proper advice from a qualified medical practitioner. This is very important.
correct.
Thank you. Thanks to both of you for this information. And finally, coming up to our basic Indian Upanishads. So, the Garbha Upanishad, which is Garbhopanishada, as it is called, as an esoteric doctrine of the embryo, which has a lot of natural uh, information to women, to the society, how a woman should be taken care of, how the family should take care of a woman. So, in the Indian traditions, when the woman gets pregnant or is tested positive for pregnancy, she's sent to her mother's house and she is pampered. And the reason is all this what we have spoken about: lifestyle, hormones, natural birthing, and there are many rituals. There were used to be many rituals which a woman used to go through towards natural pregnancy. And I think in the olden days, the sweeping, the mopping, what our grandmothers used to do, even I used to do it a lot. I've never taken bed rest right after I was detected positive for pregnancy. So I feel the more active lifestyle one leads, the better is the course for women in her later life as well, which we'll be discussing in the next webinar when we meet again for the menopausal age, how and what we need to take care of. So when we are talking about Garbha, the womb, and we say that it is a place where consciousness evolves, my question to all three of you is, in a nutshell, can you describe at least one practice which can help the consciousness to evolve in the Garbha, in the womb? We start with Dr. Geeta.
Here, actually, the Indian ancient knowledge, which has been a hidden treasure for all of us, because none of us read in detail, and whatever is explained in Garbhopanishad, what you said, and what is Garbha Samskara knowledge, which our Ayurveda speaks of, none of the practitioners giving medical care to most of the pregnant women don't know about it. This is the tragedy of our system, because the Garbhopanishad or Garbha Samskara gives such a beautiful knowledge and spiritual aspect to pregnancy, that we can have the desired child, desired qualities in the child. We know the example of Abhimanyu. Yeah, he learnt the skill of entering into the uh,
Chakravyu.
Chakravyu
Chakravyu. And
when he was
that was the audit.
in his. Yeah, that is the reality. Actually, there is a big research going on Garbha Samskara in Gujarat. There is a university which is doing a large study on the effect of Garbha Samskara on children of next generation.
Children.
So this knowledge has to be shared, and in this, the practice of childbirth classes is very important, because I have been practicing since many months. Once in a month, I conduct childbirth classes for the couple, I make sure that husbands also attend the childbirth classes. They know what is the process of labor, how they can support the woman, and once they know how to connect to their body, and the body will instruct them what to do during labor. So that connection is lacking in medical facilities, where we allow them to labor in a medical setting where medical people around, and they are not connected to their bodies. We keep pumping medicines in their system and all that. So that awareness that natural birth can happen and they are capable of having it makes them face it with confidence. And I have realized that many of the primaries, first pregnant women, who have undergone childbirth classes, who have attended the classes, will deliver normally with confidence. And the fear of childbirth, labor pains and all is not there in them, because they know what to expect during labor. So the practice of them attending the childbirth classes is very important, and that can make them prepared, or empower them to face the childbirth in a natural way. And that can go a long way in giving it a holistic or spiritual aspect to childbirth.
Thank you. Dr. Kalpana, any last thoughts?
I think just practicing heartfulness meditation would answer everything. That's my take, and we have a beautiful program called Beautiful Beginning, where, like Dr. Geeta was telling about the classes, we do have modules which goes a little beyond the physical, I mean, and the mental part which we talk about. We talked about Abhimanyu. We speak even about Ashtavakra, who had 8 limbs. So all
That was
those
transport, I
stories are there. Yeah, the stories are there to tell the pregnant women, and the affirmations are very important, and the physical, like we have spoken a lot about the physical exercises what we have to do. So going beyond their consciousness and trying to do something, because one thing I really wondered, between contractions, if you see the mother, she's in a trance, she's just unconscious in a trance. So I keep wondering what's happening there. So that's something, and again they come back when they have a contraction, and again they start to push and things like that. Again they go off into a trance resting. So it's nature's way of taking care of things. So and for one, I'm for heartfulness meditation, because the sittings they get and everything takes care of the whole. It's a whole thing which happens, like a
whole
transformation
package.
package. So transformation happens even to the mother after she's given birth, because that's a very important aspect for the family, especially the father and the mother, both of them, because the father gets neglected and mother says I have something to take care. So all this is taken care of holistically, and I think I'm for one with heartfulness meditation.
Cool. Thank you so much. Thank you for being a part of this journey for this webinar. And we welcome our viewers to visit Kanha Shantivanam and see the magic, feel the magic there. Stay there for a retreat. Feel your complete physical, mental, and your every being coming into resonance with the spiritual practices and with the beautiful programs we have there. Thank you so much. And I'll just check if
Thank
there are
you.
any questions. And if there are any questions whom anyone wants to ask even later, we will be available at Heartfulness. You do feel free to communicate with us. Thank you so much.